KIRO, Seattle.
This is COVID-19 Seattle. I'm Dave Ross.
And I'm Aaron Granillo.
Personal checks are coming to most Americans after the president signs a $2.2 trillion rescue package.
$3,400 for a typical family of four.
We'll break down the rest of the bill.
And a new University of Washington study shows the country's hospitals could be overwhelmed in a matter of weeks.
Also, Bill Gates says a full-stop nationwide shutdown is the only way to contain the coronavirus.
So we're entering into a tough period that if we do it right, we'll only have to do it once.
Stay with us.
President Trump today signed the largest economic relief bill in U.S. history.
I've never signed anything with a T on it. This will deliver urgently needed relief to our nation's families, workers, and businesses. And that's what this is all about.
All right, let's talk about the fine print now. Those direct payments, Dave, it looks like it'll give individuals who make up to $75,000 a year checks for $1,200. And it gives couples who make up to $150,000 payments of $2,400 plus $500 per child.
And then it begins to wind down over $75,000 up until $99,000. It tapers off until after $99,000 per person. You don't get anything in addition. It also increases the maximum unemployment benefit that states can provide by $600 for 4 months. And this was a fairly controversial part of the bill because, to keep it simple, they just made it a blanket number, $600 additional a month for 4 months. In some cases, for minimum wage employees, that would mean they would make more not working than they were making while working. Several Republican senators threatened to or tried to delay the bill. They proposed an amendment. It was defeated to strip that away. They were ridiculed by Senator Bernie Sanders, saying, I will not try to imitate his accent, but he basically waved his arm and said, God forbid somebody making minimum wage might make a little bit more for 4 months. And so that survived in the final bill.
I think we can imagine Bernie Sanders saying that. Nicely done. And it also extends benefits for people who normally wouldn't see them at all. So this includes people like gig workers, so Uber drivers or furloughed employees, freelancers. They now all qualify for unemployment. Here's where the other billions go. $100 billion for hospitals, $350 billion for small businesses. Those would essentially just be grants that businesses would not have to pay back. And then $500 billion to corporations, including airlines and cruise companies, plus another $150 billion or so for states and local stimulus funds. And also, Dave, a lot of money in terms of loans, trillions of dollars for loans.
Well, you might be confused because originally the bill was described as being $2.2 trillion. When the president signed it, I think he said 6 point something. The difference is that the Federal Reserve is authorized to have basically letters of credit, available credit to give to large corporations. But the Democrats wanted to make sure strings were attached to that. But the bottom line is it turns out to be over $6 trillion in available money should corporations want to take advantage of the full amount.
There's a new University of Washington study that seems to indicate that the peak of our outbreak could hit the state in mid-April. KIRO Radio's Hannah Scott talked about it on Seattle's Morning News.
So tell us about this new University of Washington study where they have used their mathematical magic to try to predict what the timeline is going to be here.
It's the first one that looks at the deaths that have already happened, so it's a little bit different than some of the projections we've been getting, and it's pretty ominous, and it really, really argues for you have to maintain the social distancing. Even with what we are currently doing, and this is on a national level, over the next 4 months, they estimate between 38,000 to 162,000 are going to die from this disease in this
nationwide.
State. This is nationwide.
Yeah.
Now, here in Washington State, the death, it was 1,429, I believe, is what the projection is in Washington. If we do what we're doing now, they say that trajectory goes way up if we change anything, ease down from any of the social distancing that we have right now. By August 1st, we would have a massive amount of deaths if we changed anything.
Okay, and I was looking this up because, of course, the arguments made early were that, hey, do you know how many people the flu kills every year? The 2018-2019 flu season was 34,200 flu-related deaths nationwide. The median estimate of the UW study is 81,000 people from COVID-19. So, some people have no symptoms. I acknowledge that, but it sounds like the people who said it was deadlier than the flu were correct.
Right. And that, again, has been all the way up to Dr. Fauci, who said it's 10 times, I think just yesterday, he said it again, it's 10 times more deadly. And then the bigger problem with this illness is that it spreads so much faster than some of the other things that we've seen. So we'll see what happens, because I know that this group is going to continue to do this to try to inform decisions moving forward, but it certainly argues in favor of the social distancing. This wave is supposed to hit us in 2-3 weeks is where we're supposed to hit maybe the peak of this, where we're going to see all of the hospitals so busy. And right now, look, they have limited supplies. There's new guidelines about how to not follow the normal hospital procedures for your protective gear that you use, how to kind of stretch it out a little bit longer. So they're worried about hospital staff being overworked and getting sick, various things like that. So the governor put out a call yesterday to anyone who has retired or moved out of state, has just graduated. If they want to give a couple of weeks or more of their time and come back, they've changed so many rules at both the state and federal level, where you can come, if you have an out-of-state license, you can come practice here. And there's a lot of other things. It's very simple. They need medical personnel to call up and come and donate their time.
And what is happening at CenturyLink Field? Explain that. I heard the Lieutenant General saying they're going to turn it into a hospital.
It's one of, there's, I think, 2 locations. I don't know what the other location is in the state, but they're looking to set up a field hospital. And that's one of the areas where I think it's a team from the Army Corps of Engineers from Colorado are coming today, possibly to look at it and see if that might be the place we want to set up a field hospital.
And this would not be for the COVID-19 cases. This would be to take the other cases that the hospitals wouldn't have room for?
That's the idea, is my understanding. Yes, they're trying to make sure there's enough medical care for the rest of us, whether that's at a field hospital or just a laptop because you need to see your regular doc.
KIRO Radio's Hannah Scott. Thank you, Hannah.
You bet.
Bill Gates thinks the entire country should shut down right away. He tells CNN that's the only way to stem the spread of the virus.
So we're entering into a tough period that if we do it right, we'll only have to do it once for 6 to 10 weeks. But we have to do it. It has to be the whole country. We do then get an economic problem, which is why you want to minimize the amount of time. And having states go at different things or thinking you can do it county by county, that will not work. The cases will be exponentially growing anywhere you don't have a serious shutdown.
Okay, but this is not what President Trump thinks or what he wants. His administration, Dave, it actually laid out this plan to respond to the outbreak county by county.
Right. They're going to apparently try to collect this data and find areas of the country where there are fewer cases on the assumption that then you can then open them up and let people return to work. I know Gates feels that's dangerous. I'm pretty sure that Tony Fauci feels that's dangerous. So it sounds like I don't know if it was Gates who initiated this comment today or if he was asked to do it. But it sounds like people who are close to the data are trying to persuade the president not to try this because it might be a disaster.
Right. And I mean, the thing about this virus is that it doesn't care what county you're in, right? And you can't restrict travel county by county. So let's say you do open up work in Walla Walla, right? And then what's to say somebody from King County can't go over there and then spread the disease that way, right?
Well, you might find, I suppose they could try it and see what happens, but if the worst does happen and you see huge outbreaks, like for example, somebody decides, okay, we're safe here, let's hold some kind of big, celebratory picnic, like happened with Mardi Gras down in New Orleans, and suddenly all these cases pop up. You will see nearby cities who've just spent billions to try to stop the spread. I imagine taking temperatures at the border, or, I can't imagine that you would allow people to travel in from the outside into a city that has just disinfected itself and make us go through the whole thing again.
So even though this flies in the face of pretty much every public health official, I get what the president is trying to do here, though, because he's trying to give, businesses sort of a timeline here. Because businesses are hurting right now, small companies and corporations. And he's saying if we can get the company rolling by mid-April, that gives people some hope.
Well, you got to be careful. When you have something that hasn't got a vaccine, you threaten undoing all that hard work. Not that staying home is necessarily hard work, but I mean, it's certainly definite inconvenience. I want this to be over as soon as possible. It'd be terrible to isolate ourselves for whatever it is, 4 weeks, 6 weeks, 8 weeks, and then have to do it again later in the year because we decided that certain counties were okay. That would not make any sense. We will be back tomorrow and every day after with a 10-minute rundown of the daily local news. You can subscribe to this podcast, and you can also find our news coverage on mynorthwest.com or listen live at 97.3 FM.